Thank you to the organization. It's always really a pleasant experience to be here at IMT. So I will talk about contagion processes in complex societies. And now, after the talks of the previous sessions, Chris, Madhav, Shannon, in one way or another, you know everything about synthetic societies. I will try to get my own perspective that perhaps is slightly different in the sense on the way we approach the problem. Then obviously the methodologies and the results in a sense are the same, but it's possibly a different way of looking at how we got there. And obviously there are differences, and differences are even in the nomenclature at this stage. As we know, we have seen synthetic population, synthetic ecosystem, complex, etc., etc. So my point, starting point, is actually a very physical problem in which we start from the bare bone of the problem, and this is why I talk about contagion. Obviously there are many more phenomena that probably can be mapped into this scheme, but contagion phenomena in which we have a transmission among individuals, that could be a pathogen or could be even ideas or knowledge, are obviously falling in that category. And stripping to the bare bone the problems and making it what in physics we call reaction diffusion processes. So at this point the individuals are not anymore very complex object. There are not a lot of internal state variable. Actually, there are only one or two attributes for each individuals, and they are particles. They are particles that, in the very simplest definition of those kind of models, wander around in space that often we schematize and stylize as a network. This could be a network of location. In some cases, it's not even a network of location, but each individual is just one node of a network. And this is, you can start to initially to look at those processes as chemicals. So it's like having reaction diffusion processes in a chemicals. You have some rules, some rates of interaction, and then you have these contagion processes in which particles change states. Well, what we do at this point is to start addressing those elements of the network. And so what we start is to create a layer that goes on top of these bare bone elements of the network. So basically we add layer that corresponds to the geography, so where the particles are moving, then what is the quantity of particles in those places, and then perhaps what is the age and sex of those particles, and so on and so forth. And so basically all those are layers of information, and here we get again to another definition, information systems for population, in which we put all those information on top of those layers. Well, the other issue is that at a certain point those particles have to move, and they don't perform a Brownian motion. So they have certain patterns of contacts, and so this is what we do when we start to add a layer that corresponds to what we call the mobility data. This is extra information again that goes on top of the particles and the space and the topology we use in the model. And finally, there is a last part that is the actual model, is the actual process that we are trying to understand. That is, in a simple case, could be a disease model, it could be a knowledge contagion phenomenon, etc., etc. But it's something, there is no model that fits all things that we have to see. Now, there are two important points that I want to stress. First of all, this construction is not universal. And this is something that has to be brought to the attention. It's, you cannot define the ideal population unless you really reconstruct the real world in the computer. Depending on the problem you want to tackle, the model that you are studying, the phenomenon, you might emphasize a need of certain data in the synthetic population and not others data that could be completely irrelevant, or perhaps even, create interference with what you want to see. The other things that is important is that generally, the problem of creation of synthetic population is in the data, is in the data construction, but generally this is something that is not what I would call an HPC problem. the HPC problem comes when you do the dynamics of those synthetic populations. So at the level of technology that we have now, those synthetic population, you can see, can be created, and you need one synthetic population. You don't need thousands of realization of those synthetic population, while you will need, as Chris was saying, thousands of realization, of stochastic realization of the process and the exploration of the parameters. Well, what is also the main things that we have to add in this process is the dynamics. And the dynamics is indeed, what determines the interaction of those particles. Well, these are data that were not, really unprecedented until a few years ago. And now we have basically spanning the full range from the microscopic interaction of the particles. So, for instance, our people interactions is an experiment that Ciro Cattuto and Alan Barad does to, the mesoscale, so trace from cellular phones or other digital traces up to the macro scale of, for instance, our international aviation infrastructure and so on and so forth. Those data, it's important to consider that are mostly networks. Again, here we are starting to construct these large-scale networks because these are generally contacts or origin destination mobility points. And so basically they find a natural representation in networks and thus opening a series of problems in terms of representation, mathematics, et cetera, et cetera. I don't want to go into that. When we have that, the model architecture is fairly simple as a scheme. So we can create models in which basically the synthetic population, the complex society that we are trying to model, is the input of what we are doing, in the sense that is part of the, is what we call the structural data. So these are data that comes from the outside world. These are data that generally, unless we do, what we want, what we aim to, is to not parameterize that part of the model. Should be real data, so that basically we don't have any or very little assumptions on that part. And then there is what we call the dynamic engine. So this is the expensive computational part, is where the problem starts. That basically simulates the interaction, the mobility, and the transformation of this individual during the contagion processes or whatever other dynamical processes we're modeling. And there are, different things that we can do. We can generally partition the model through hierarchies of places. And so you have always generally an intra-dynamics, that happens at the cell level of a single city or a single population, or etc. And then there is what we call the interdynamics. When you have global models, you start to connect cities, you start to connect places, you have long-range mobility. And those are different also time scales. You have to think that, when you drop the kids to school and you go to work, this is the agency that was mentioned before, you do things that are on the scale of a few hours, a couple of hours at the most. When you travel internationally, at least you are talking about the time scale of days. And so, these are all the classic problems, for instance, that we have the multi-scale problem in the solution of those models that we have faced in other areas, like in physics and engineering. So, then there is the output of the model. That is another huge issue, because those microscopic models with microsimulations generate enormous amounts of data. And the exploration of those data becomes a big data problem by themselves. And I will try to give you a little example later. So, obviously what we have is that we can define stochastic population. This is just a simple example to show you what is the multi-scale problem. You have, you can look at New York, and New York has a certain number of connection by airlines, but then if you look at the commuting pattern within New York, between basically neighborhood in New York and New Jersey, etc., you have a completely different time scale and magnitude of the mobility and interchange of people. But, these are all, again, these are data. This is something that gets into the system. The problem is how we solve the model. So let's imagine that we have partitioned our world in a set of what we call metapopulations, so a certain area, census area, in which we know the number of individuals, their attributes, et cetera, et cetera. At that point, you can start to add to approach the problem in different way. We don't always have to go, basically, our dream, the dream of everybody, is always to start at this level. This is the agent-based model that have been eloquently explained before, in which you have single individuals, you build the households, you assign to school places, to workplaces, and then, you get this complex multipartite network of interactions with different strength of interaction if you talk about contagion processes that will depend on the time that the people spend in those areas. And then this network can be projected into a unipartite network for individuals that obviously is a huge network. If we are talking about, the example of the United States, we are talking about 300 million individuals with billions of connections of different type. This is the dream, but we can also create systems that have a hierarchy and a hybridization of model in which we don't have always to go to that level of complexity, or we don't have to go to that level of complexity in all places that we are modeling. And so, for instance, we can look at models in which we create what we call effective contact matrices. So from the agent-based model that you define, you can create, for instance, maps of interaction among age bracket. You get a stratified version of the population in which you know how much 5 years old interacts with 5 years old, with 10 years old, etc., and create a more simple reproduction in which, in an effective way, you bring some of the elements of the agent-based model, but the simulations approach is much more simple in terms of numerical and computational complexity. And you can actually strip down some of these elements, and in other areas you can even go to somehow what we call the homogeneous assumptions, in which you have still individuals, they are discrete, but the interaction in a sense becomes much more fuzzy, much more effective, what we call effective force of infections. And so you see, you can tune and hybridize those approaches in what we do in synthetic societies and in contagion processes. This is what we try to realize in the last few years by creating basically what we call the global epidemic and mobility model. This is a platform, is a framework that allows to have the construction of those layers, and most of the layers are included in the model. And then from the construction of those layers, you create basically a kind of synthetic world of which you can decide where to focus more. So if you want to use an hybridized version in which there is an agent-based model in a specific region and a more simple description of the disease in other region of the world, you can do that. This is something that Luca Rossi will present later. And this approach allows you to simulate model, to do forecast, to do basically to tune your description of the phenomenon. And this is something that is publicly available in a simplest in its simplest version. And we have more complicated, more advanced versions that are available upon request. And what we do is simple at the end to create simulations which we start really with a certain number of individuals, and then we track individuals across the world and how the epidemic diffuses or other phenomena of diffusion occurs in the real world in this synthetic population. What is interesting is that, again, what we do is to create simulations that works and can be exploited in terms of geography, and exploited especially in a cognitive way in geographical on the geography, because this is what we can relate in the easiest way. But we have always to take into account that what is working under the hood of those simulations is those large networks that were mentioned before. So what we are doing is to construct at the end very huge network of elements, of agents which are tagged, and then obviously the geography is one of the tags. We project back the geography, but from an algorithmic point of view, we are not considering any more diffusive process in geography or continuum space. Well, I want to give you, how many minutes I have more, Michele? Oh, okay. So I want to give you an example of what we can do with that model and how it can be enriched, and when we think about complex societies, where those complexity goes. And to do that, I use the example of the Zika epidemic. This is something that many of us have been working on in the last few months, and the problem is that Zika was a plus. was a neglected tropical disease. And basically we knew about Zika, but it was just in a few places of the Far East, not big, issues, because it's mostly asymptomatic and there was not a very large knowledge of the disease. Suddenly, a kind of a very large cluster of microcephaly has been reported in Brazil towards the end of 2015, and then in 2016 the WHO issued basically an international health alert, because actually the Zika infections in pregnant women are related to microcephalies and other birth defects, and so at this point we have an emergency. But what was peculiar is that actually the disease surfaced in Latin America. Latin America had basically a complete naive population to the disease, and basically Latin America was experiencing a very large wave of the disease. Now, contrary to other cases that we have faced in the past, like the flu, even Ebola, etc., the problem is that for Zika, we have really very limited information, not in the sense of what are the mechanisms of the disease. This is a disease that is vector-borne by mosquitoes, but on the fact that when medical doctors and epidemiologists were able to pinpoint the disease and the epidemic was there since already a very long time. And basically, we didn't have any trace of of the evolution of the disease and the spreading of the contagion process due to Zika in 2015, 2014. So there is no information. Nobody was collecting data. And so the first cases notified, etc., are starting in 2016. And there are some retrospective studies on some French Polynesian island, some data from Brazil, but really very little knowledge. And so in a sense, in this case, we were facing two problems. One is the classic future. What we can understand about the future of the disease, how it will spread in the future. Can we, with the modeling, help in understanding the unfolding of the epidemics, but also to get retrospectively and say, what happened in the past, where we didn't have the data, basically. What was the course of the disease? How many cases, how many people have been infected in Latin America? How many microcephaly cases that generally will appear 9 months later, we will see in the next few months, et cetera, et cetera. That is where you start to create then a synthetic population that can describe the disease. And here is where you have to make the exception of what is important for the disease. So there is no synthetic population that fits all diseases, because if you want to describe a vector-borne disease, first of all, you have a very important component that is the usual, is the mosquito presence, is the mosquito population. You need to understand where mosquitoes are, where is the abundance of mosquitoes, the type of mosquito, their life cycle, et cetera, et cetera. So on top of the usual global and epidemic mobility level that we are mapping with the population, et cetera, you have the mosquitoes. And so you have to gather those data and integrate as an extra layer in the model. But then there is also something else that for other diseases might be less relevant, but really for Zika and other vector-borne diseases by mosquito is very important. So that is the economical and the development index of the country. Obviously, if you're in a country where basically you live, most of the houses have air conditioning, net screen, et cetera, the people exposed to the disease is very low. If you're in places like a slum of a big city, well, then the exposure of the population, that is the 100% of the population. And so if you don't take into account those factors, what you would get is that, for instance, Zika could be, having an attack rate of 80% of the population or a very small fraction. And so you have to balance and include those data in the model at the possible finest resolution. So that it's a lot of work that you have to include. And as usual, as I was saying before, I use this vision of layers that you add. And so basically you need the mosquito abundance. The mosquito abundance is extracted from the mosquito presence that is provided by entomological studies. And actually there is a lot of computation there. There is a lot of machine learning just to figure it out how mosquitoes are spread in the world. But then the abundance is related also to the life cycle of the mosquito. The life cycle of the mosquitoes is related to the temperature. And so you have to use a layer that provides the daily temperature of in each place that you are monitoring. And then there is, the problem of the exposed population. And so you have to create effective exposure to those to the mosquitoes through what is the density of the population, the climate in that region, as well as the economic development of that area. All those layers at the end enters in the dynamics in this part that at this point seems the small part, but actually still the most time consuming, that allows you to project and to create an evolution of the epidemics. Now, just in 1 minute and to say, you know, obviously there is a lot of technical details. There are a lot of equations. This is not a model that throw in a bunch of data and gets out and spit out a reply. So you need to really integrate the equation. Those equations are the epidemiological model of vector-borne diseases. So you have this model in each region that you are mapping, and then you have interaction due to the mobility. You have to be infected with Zika from a mosquito, then travel to one place, bitten by another mosquito that will transmit the disease on its turn. And so this is a complex spatio-temporal pattern in which the human mobility, the weather, the temperature, the mosquito presence all interplay together to create and shaping the disease evolution. And now here is where you have the computational implementation that hits the bottleneck of the high-performance computing, because you have to do large-scale numerical simulation for 7 billion individuals with all those data, you know, and you have to simulate this process. Well, we need to start from 2013, try to inject the disease in Latin America in 2013, and then see the evolution of the disease, see what was the best match with the few data in 2016 and 2015, and then select, the appropriate parameter space. All this process involves the runs of millions of simulations that are very computational expensive. And so we are talking about 12 million runs at this point. We have developed almost 1 million instances on cloud computing. This is all those numbers that makes an effect. You know, it's 110 years of computation of what would be a very powerful workstation. So, but at this point, the model creates an amount of data that is of the orders of hundreds of terabytes for each scenario. Now, this terabyte is because you need the daily number of infected people, the daily number of mosquitoes, and the density of infected mosquitoes. All those data are produced for 4 years in all places in the world. This amount of data has to be analyzed, and you cannot do that without resorting to things like big data analytics and pretty much advanced analytics. And so each, as you see, we are talking about really opening, a box in which you look at one possible scenario of your modeling and you have a terabyte of data popping out. So this is the problem. Let me show you just quickly a couple of results. What you do is that you try all the possible places of introduction and all the possible date of introduction from 2013 to 2014. And that's why, because mostly people was thinking about an introduction of Zika during the World Cup in June, July, August of 2014 because of traveling flows, etc., etc. Well, actually, you can do that. You do the usual techniques, Monte Carlo likelihood analysis. You look at the simulations that then more or less agrees with data coming from Brazil and Colombia. And if you do the posterior distribution of those analyses, you actually find a lot of information about the past history of the disease. Basically, the likelihood that the disease has been introduced in Brazil is very little for the World Cup, and actually the peak, most of the likelihood, so to say, what we say, the 90% confidence interval is between October to December 2013. So basically more than 6 months or 8 months before the World Cup. This has now been confirmed by phylogenetic analysis, and this is something that tells you how much can tell you the numerical model about this. Obviously, this is insight into the past of the disease, and this is actually very important. Obviously, then you can start counterfactual reasoning. So, well, the model will not tell you how many microcephaly there are, because that depends on the risk that an infected pregnant woman will give birth to a baby with defects. But what you can try is to look at different risk intervals and then compare with what will happen from what will come from the data in terms of microcephaly. And so you can try different risks that have been, estimated through retrospective analysis, etc., and project those number of cases. This can be used as a guide to really say, okay, is that risk factor better suited to the data that we see or not, depending on the simulations. The other thing is that you can also get a lot of situational awareness. And the situational awareness, for instance, is that those kind of model allows you to simulate also how many cases of Zika infection you are importing from a country, in a country that already that still doesn't experience a local outbreak. We did that for the United States, and you realize that in the United States there are thousands of cases more than what is monitored by the system. And this is obvious for a disease that is symptomatic in basically 20% of the cases, and actually really with strong symptoms in only 5 to 10% of the cases. So you see that in the United States, what we project is very well correlated with the cases, but with a factor that is very large. And indeed, the detection rate that you can estimate is about 5%, 7% of the cases. Now we have a better estimate to do that. That is the number of pregnant women that are monitored in the United States. We know the number of people, of pregnant women on average traveling on airlines. And so from that, you can extrapolate and get a much better number that indeed is in the ballpark of what we see, probably of the order of 100,000 cases in the United States. This gives you situational awareness. The model accesses things that generally are not accessible. So in a sense, what you get is that you get more than forecast with those approaches. And since we talk about using synthetic populations in a way that is always, okay, we can provide tools to forecast, etc. Well, it's not just the forecast. In many cases, it's the situational awareness, the intervention planning, projections, counterfactual experiment of different kinds. All that provide the importance of modeling, despite the assumptions or the lack of data that in some cases you have to work with. And this is actually, there is an interesting paper that the MIDAS collaboration, including Madhav, has been written a couple of years ago in the eve of the Ebola crisis about how we can use numerical simulation. So I think I can close here and just thanks the many collaborators that I have been working on this last part, especially on Zika, but also on the definition of the GLIM platform, although I would have probably to list at that point almost 100 persons, but this is the people that have been working in the last stage of the modeling and what I've presented. Thank you very much.